Now this is the arch of aorta. This is the superior vena cava, dividing into the right and left brachiocephalic vein. Alright. Below it is the right atrium, and more below there is below the right atrium, crossing the diaphragm. This is the inferior vena cava. Alright. I have drawn the upper part of the superior vena cava only. When it is giving out the right and left brachiocephalic vein, right? And from the arch of aorta, you can see there are 3 branches. During your Viva exam, some people will be always asked what are the branches of, main 3 branches of the arch of aorta. What are the 3 main branches of the arch of aorta? Number 1, on the right side. On the right side, this is the right brachiocephalic that gives rise to right common carotid and right subclavian. Then is the left common carotid. Then the left subclavian. Alright. Remember, as the arch is not in a, arch of aorta is not in a horizontal plane. It is a little oblique from the anterior posterior plane. So that you will not be able to see all these 3 branches at one gauge. At a gauge, through one gauge, you will not be able to identify this is the right brachiocephalic, this is the right common carotid, and this is the left common carotid, this is the left subclavian. Because the arch of aorta is anterior to posterior like this. So this is one branch, this is one branch, more posteriorly one branch. Understood? And you see on the back of the arch of aorta, there is the trachea, and more behind is the esophagus. I have not drawn here the esophagus. More behind is the esophagus. All right. I put 1, 2, 3 and 4. 4 structures over the arch of aorta. Number 1, this one is the left phrenic. Then the superior cervical cardiac branch of vagus, inferior cervical cardiac branch of left sympathetic, then the left vagus. Alright. So it is the left phrenic, superior cervical cardiac branch of the vagus, inferior cervical cardiac branch of the left sympathetic, then the left vagus. These 4 structures. In front of which there is superior intercostal vein. It will be clumsy. It will be clumsy to draw the superior intercostal vein here. It will be clumsy to draw the superior intercostal vein above all these structures. Alright. And behind this there is trachea. Below is bifurcation of trachea, and there are superficial. This is the superficial cardiac plexus, and this is the deep cardiac plexus. ठीक है? At the bifurcation. Now you see there is one red structure connecting the left pulmonary artery with the arch of aorta. The thick red line connecting the left pulmonary artery with the arch of the aorta. This is called ductus arteriosus or ligamentum arteriosum. This is ductus arteriosus or ligamentum arteriosum. This is hooked by the branch from the left vagus.
Accepted.
Coming from the left vagus, a branch that hooks. This is and it comes in the groove between the esophagus and the trachea. This is the left recurrent laryngeal nerve. This is the left recurrent laryngeal nerve. And remember, on the right, in the left side, the left recurrent laryngeal nerve hooks the ligamentum arteriosum and comes in between the groove between the trachea and esophagus. And on the right side, it hooks the right subclavian artery. This is an explanatory note commonly asked in the examination. Why the left recurrent laryngeal nerve hooks the ligamentum arteriosum, and why in case of the right side, the recurrent laryngeal nerve hooks the left, that is the right subclavian artery. The explanation is, you do not know the arterial arches. Once I tried to give you the diagram for the arterial arches. Anyway, the dorsal part of the sixth arterial arch, the dorsal part of the sixth arterial arch gives rise to the ligamentum arteriosum. All right, on the left side. On the right side, there is no ligamentum arteriosum. That is the dorsal part of the sixth arch obliterate, and whole of the fifth arch obliterated. So what is remaining? It is the fourth arch from which the subclavian artery develops. So the dorsal part of sixth arch is not present in the right side. Whole of the fifth arch is missing in the right side. Only the fourth arch is remaining, from which we get the subclavian artery. So from the when the vagus descends on the right side, the recurrent branch is hooks the subclavian artery on the right side. This is a common explanatory note commonly asked in theory paper, right? Now, this pulmonary trunk bifurcates below the tracheal bifurcation, and it passes above the right and left bronchus. This comes in front of the right and left bronchus, right? And in the lower part of the tracheal bifurcation, you see there is superficial cardiac plexus and the deep cardiac plexus. Deep cardiac plexus usually divides into two. Anyway, so you have understood why the recurrent laryngeal nerve hooks the ligamentum arteriosum on the right side, whereas the subclavian artery in the left side. All right. Now, up to this, you can identify these structures, isn't it? And the groove between the esophagus and trachea, there lies the recurrent laryngeal nerve. Recurrent laryngeal nerve, the position of recurrent laryngeal nerve must be remembered, right? Now, The origin of phrenic nerve supplies on either side. Phrenic nerve supplies the diaphragm, but it takes origin. Diaphragm is at the level of abdominothoracic region. All right, but the phrenic nerve that supplies the motor, sensory, as well as the proprioceptive fibers comes from C3, C4 and C5. Why? Why the nerve to supply the diaphragm comes from cervical region, that is C3, C4 and C5. Why it is coming from the cervical region? Why the nerve supply to the diaphragm is coming from the C3, C4 and C5 root. Any idea? And you see C3 and C4 root is joining in front of the scalenus anterior, and the C5, C6 root that supplies the subclavius. And there is one branch that is joining with the C4 and C5, hooking the subclavian vein and forming the C3, C4 and C5. This is the phrenic nerve on either side. Now, if you see the course, you will not be able to understand how this subclavian artery branches, that is the suprascapular, transversal, cervical, these branches are crossed by the internal thoracic artery, is crossed superficially by the phrenic nerve. But you can remember that the phrenic nerve comes in front of the root of the lung, not behind the root of the lung. On either side, the phrenic nerve comes in front of the root of the lung. Then it passes downwards. On the right side, it passes through a venous root. On the left side, it passes through an arterial route. All right. On the right side, there is brachiocephalic, on the side of the brachiocephalic vein, then the superior vena cava, then the right atrium, then the part of IVC. This is the route for the right phrenic nerve, and it passes in between the gap of the lung, that is the pleural tissue, and in between the heart, that is the pericardial tissue. So the phrenic nerve is within the areolar tissue, in between the heart and that is the pericardium and the pleura. The pericardium, the phrenic nerve is accompanied by pericardiaco-phrenic vessels on either side that lies within the gap between the pericardium of the heart and the pleura of the lung. বোঝা গেল কোথা দিয়ে আসছে কোথায় যাচ্ছে? বোঝা গেল না বোঝা গেল না? In case of right side, remember one thing, the right passes along the venous route, that is the subclavian vein, that is the brachiocephalic vein, the superior vena cava, then the right atrium, then along the IVC. So it is the venous route. On the right side, there will be arch of aorta, then the left ventricle, then the descending thoracic aorta, and blah blah blah, all the arterial structures that is available to the right phrenic nerve, left phrenic nerve, right? If I say any more detail about the right and left phrenic nerve, you will not be able to identify the structures that is encountered into the course of the right and left phrenic nerve. All right. Only that you should remember through which aperture left phrenic nerve and right phrenic nerve enters into the abdomen. And after entering abdomen, what does it do? After entering into the abdomen, what does it do? It is customary to describe the branches of the phrenic nerve from the inferior surface of the diaphragm. Some people say that the superior surface, that is the superior surface of the diaphragm, is also supplied by the phrenic nerve. Okay? It enters the abdomen and usually supplies from the inferior surface. This one, this is piercing the diaphragm, and supplying the diaphragm from the inferior surface. And from the inferior surface, there is phrenic ganglion and ganglion to the hepatic tissue. And it is also supplying the suprarenal gland. It will also supply the suprarenal gland. Here I have drawn up to that much. Remember that the right and left pulmonary trunk comes superficial to the right and left bronchus. The pulmonary trunk comes from the right and left bronchus. And the right and left phrenic nerve also comes superficial to the right and left bronchus. Got my point? Can you imagine the pathway of right and left phrenic nerve, at least for right phrenic nerve? Imagination asks, can you imagine? The first rib, the scalenus anterior, in front of the scalenus anterior, the C4, C5, C3, C4, C5 nerves are entering, and from this it is coming down in front of the root of the lung, then taking the space in between the pericardium and the pleura, going downwards to pierce the diaphragm. And within the abdomen, it forms phrenic ganglia, gives some branches to the suprarenal as well as the coronary and falciform ligament of the liver. This part you will not be able to understand because you do not know coronary ligament or falciform ligament. Tumra jano? Do you know this? So I have limited my discussion. of the course of phrenic nerve at that point. All right. Now, whether you close your eyes, take a deep breath and try to locate the structures I have drawn. What is what? Women, usually in her 40s, to flick and attack the thumb, there will be excruciating pain at the root of the thumb. All right. And if you ask her to attack the wrist joint, there will be pain at the enshipment of the abductor pollicis longus and extensor pollicis brevis. All right. This is known as de Quervain's tenosynovitis. All right. And when you attack this hand, there will be pain at the enshipment, at the root of the thumb. All right. This is called Finkelstein's test. Finkelstein sign. Finkel apostrophe Stain. Finkelstein sign or test. I have asked you several times that anatomical snuff box, if you are asked, there is no escape. Okay, thank you. Thank you all of you.